Have you ever come across an occupational therapist and thought, what exactly do they do? Hi, my name is Gabby Smith and I'm a pre-occupational therapy student at Kansas State University. This summer I am shadowing several different occupational therapists in several different settings, and that's where I've obtained most of my information about occupational therapy. Today I'm here to tell you a little bit about the career, so the next time that you hear about occupational therapy, you have a better understanding of what it is. Occupational therapy is a type of therapy that helps people of all ages get back to doing their daily activities as independently as possible. According to the American Occupational Therapy Association, some of the most common occupational therapy interventions include helping people recover from injuries to regain their skills, helping children with disabilities to participate fully in school and social settings, and providing support for older adults experiencing physical and cognitive changes. According to the U.S. Bureau of Labor Statistics, occupational therapy helps with people of all ages, from newborns to elderly, who have an illness or disability, to do things that are important or meaningful to them, such as eating, cleaning, cooking, changing, going to the bathroom, work activities, school activities, pretty much anything. Occupational therapy services typically include three important things. The first is individualized evaluation, in which the occupational therapist works with the patient to determine their goals for the end of therapy. The second thing occupational therapy services typically include is customized intervention, which helps to improve the person's ability to perform the tasks and then to reach their goals at the end of therapy. The third thing occupational therapy services typically includes is the outcome evaluation, to ensure that the goals are met, and that if the patient isn't reaching their goals, that they have to change their intervention plan so that the patient can reach their goals. Occupational therapists can work in many different settings. I've created this area of work chart for occupational therapists to showcase some of the most common areas that occupational therapists work in. Occupational therapists can work in hospitals, like for example, someone who just has surgery and has to stay in the hospital for a couple more days. Occupational therapists can give them therapy before they go home. Occupational therapists can work in rehabilitation services. They can work in nursing facilities or nursing homes with the elderly. Occupational therapists can work in something called home health, which is where occupational therapists travel to the patient's home to give them therapy in the comfort of their own house so that they don't have to travel to an outpatient site. Occupational therapists can work in outpatient clinics, where that's the opposite of home health, where the patient comes into the clinic to get therapy. Occupational therapists can work in private practice if they want to have their own business for therapy. Occupational therapists can work in school systems even with children who have disabilities to get them to work the same with other kids. Occupational therapists can even work in community agencies, and examples of that are like returning to work programs or even prisons. So this is just a few of the most common examples, but this is not all the fields that occupational therapists can do. Now, to become an occupational therapist, you need to obtain a master's degree in occupational therapy, as well as you need to pass the national board exam to become a licensed occupational therapist. And to become a licensed occupational therapist is why you need to practice. You have to be licensed first. According to the U.S. Bureau of Labor Statistics, the average salary for occupational therapists is about $72,000 per year. Occupational therapy is a growing career, and the need for them is increasing as well. According to the U.S. Bureau of Labor Statistics, employment of occupational therapists is expected to increase 33% from 2010 to 2020. Occupational therapy will continue to be an important career because as our population and generation is getting older, and as the baby boomers are getting older, they're going to need therapy when they get older, so occupational therapists will have that knowledge to provide them with that care. Occupational therapy is a great career centered around the patient to get them to be independent in their daily lives again. It is not only a rewarding thing for the patient, but occupational therapy is very rewarding for the therapist as well. Thank you for listening to my informative speech on occupational therapy, and I hope the next time you hear about occupational therapy, you have a better understanding for what it is.